Good afternoon, my fellow Coloradans. I want to give you an quick update on where we are with COVID in our state. Today, we show 2,091 new cases. Now, that is not necessarily a big increase. Why? There were 888 cases that were just added in backfill that had been reported late. So it actually backfills the last few days with slightly higher numbers than expected, around 1,200 today reporting. So trends continue stable. That's a lot of folks still getting sick. It's still very prevalent in our communities, but there's no data to show that it's an increase at this point. Simply a backfilling in the last few days. We have the good news on hospitalizations, down to 430 people currently hospitalized in Colorado from coronavirus, and that is a decrease of 26. I send warm wishes to all those who have a loved one in the hospital to wish for their speedy recovery. And I hope that as many as possible can fully recover their health. I want to take a moment to acknowledge the loss of 5,568 Coloradans who died from COVID. Of course, the number who died with COVID is much greater, but we talk about the number who died from COVID, 5,568. And to each and every one of their survivors, spouses, kids, sisters, brothers, friends, please accept on behalf of the state of Colorado my sincere condolences. As of this morning, the vaccines continue to be rapidly rolled out. We've administered 616,000 first doses, 271,000 second doses. And I'm proud to say that we've already vaccinated with at least one dose 302,338 Coloradans aged 70 and up. That brings us more than 3/4 of the way towards our goal of vaccinating 70% of everybody 70 and up. We've now vaccinated 77% of those towards our goal of vaccinating 70% of those 70 and up. And by the way, we don't want to stop at 70%. I really hope that, especially for people 70 and up, that we get in that 80 to 90% vaccination range. It is 3/4 of our deaths are people aged 70 and up. 42% of our hospitalizations are people aged 70 and up. But this is a floor, not a ceiling. When we talk about we're 77% of our goal towards 70% of people 70 and up vaccinated, we don't want to stop there. We want to reach 100%, and we really hope that there are then more on top of that 70% that want the vaccine, 80, 90%. The more, the better, especially for those who are most vulnerable. I'm also proud to report that we have vaccinated 35,618 Coloradans aged 65 to 69. That's 22% of the way towards our goal. The 65 to 69 will, as we talked about, take into March. We expect we will reach the goal for 70 and up here in February. Earlier this week, we were thrilled to hear from the Biden administration that we'll be getting an extra 9,000 doses a week for the next 3 weeks. That's great news. And just yesterday, the administration announced that the U.S. will have enough doses to vaccinate every American who wants it by the end of summer. And we will provide more information on timing as soon as we get it with regard to those future developments. This was just breaking news yesterday. Each day, we are getting closer to our goal. But despite the fact that the life-saving vaccine is quickly working its way into arms and protecting people, we all know we're not out of the woods yet. The pandemic is not yet over. We need to be careful. We need to be cautious. With a long weekend ahead, it's important not to forget how dangerous the virus is. I know that many people really want to spend time with extended family and friends and many others, but we need to continue to acknowledge that the public health crisis is still with us for the next couple of months. We can't act like it's over. Wishing that it wasn't here doesn't make it go away. Be careful, be cautious, take precautions, wear masks around others, try to stay 6 feet away, limit social interactions with people that are outside your household. I'm very proud of the trajectory that Colorado is on and the stabilization in COVID rates. And that's really thanks to your hard work. The spread of the virus is a function, by and large, of people's individual choices, individual behaviors. And the data shows that Coloradans are day after day choosing to do the right thing, wearing masks, avoiding social interactions, keeping 6 feet of distance. And I know none of that is easy, but you are and we are taking the steps to protect ourselves and our loved ones. And we just have to keep it up a bit longer. We don't want to stop running with the end of the marathon in sight. And every day, more and more Coloradans are vaccinated and more gain protection, combined with the successful efforts to suppress the transmission of the virus, means that we will be able to build back stronger, better, even more quickly. Now, I want to also take a moment to address the tragic death in Colorado's backcountry, particularly as more Coloradans look to head into the mountains this weekend. Last week alone, we lost 4 Coloradans, avalanche, and 8 total this season to avalanche. Nationally, between January 30th and February 7th, there's been 15 confirmed fatalities to avalanche. That's the most avalanche-related deaths in this period since 1910. Why? It's because of the conditions. And a dry fall season coupled with the cold temperatures and low snowpack is causing a very weak snowpack, very dangerous conditions in the high country, makes it much easier to trigger an avalanche, and that will be the case through this holiday weekend, the next few weeks. And I know this is a time of year when we often see some of our best snow up in the high country in the mountains, but it's critical that the Coloradans take extra safety precautions if you're headed to the backcountry, even if you're extremely experienced in backcountry recreation, as the people that we tragically lost last week were. Check the avalanche forecast. Be prepared to change your plan. If your route is closed, it's closed for a reason. Do not go there. And keep updated in real time. And of course, bring the proper safety equipment like an avalanche rescue transceiver, probe, shovel, extra warm layers. For more information, go to colorado.com/winter backcountry safety, or for avalanche forecasts and warnings, avalanche.state.co.us. Look, this is my last update before the start of the next legislative session of the General Assembly. We welcome them to the Capitol in Denver. And of course, this has been a challenging year, and I've been proud of the relief that Republicans and Democrats in the state legislature stepped up to provide during the historic special session. And now I look forward to working with legislative leaders to jumpstart our economy in Colorado, make strategic investments that benefit our state now and long into the future. There's really a historic, once-in-a-generation opportunity to not just build back stronger and more equitably than before the pandemic, but to fundamentally reimagine Colorado's future and really create an even more amazing place where we can thrive. Strategic one-time investments, jumpstarting help for small businesses, modernizing broadband, wildlife crossings and highways and roads, and making communities more livable by investing in our Main Street revitalization and beautification, making Colorado's state park system the envy of the nation and for our own enjoyment and to attract tourists from across the country. All of these proposals have a high economic multiplier. That means that they will create jobs and contribute to the economy. For every dollar invested, we will benefit from much more than a dollar over time. And I look forward to working with our legislative champions to help transform Colorado and build back stronger. I'm excited to work with folks in the legislature to deliver real results for Coloradans. So as we head into this long weekend, please, everybody be safe. Remember that we are still in the pandemic. Be careful in the backcountry. Protect yourself from the virus. Tried and true methods that are proving effective in our state. Wear a mask. Stay at least 6 feet from others, and limit social interactions to those in your household whenever possible. And of course, take extra precautions if you're heading up to the mountains. Be safe, Colorado, and thank you. And I'm happy to take some questions.
Hello, Governor. Faith Mangan with Fox News Channel. Thank you for taking my question. I apologize to be off topic from COVID, but I just wanted to ask the status of Space Command. I know you are part of a letter asking to pause that decision and keep it. I was wondering where things stand and if you could generally talk about the importance of ideally keeping it here in Colorado. Thank you.
I'm working closely with Senator Hickenlooper and Senator Bennett to make sure that we pursue every possible avenue for a thorough and fair reevaluation of the process that led to the poor and ill-fated decision to move Space Command. So I look forward to continuing to engage with federal officials aggressively to make sure and to continue to make the case that Colorado is the best place for the nation's national defense needs to house Space Command. Next question.
Hello, Governor. This is Vinny Del Giudice at Bloomberg News in Denver. We've been talking about COVID and today avalanches. I'd like to ask you about another element of nature, wildfires. What are the experts telling you about the 2021 fire season in Colorado and the region after last year's terrible blazes? Thank you very much.
Yeah, so a lot of the formal forecasts haven't been issued yet because we're still in our wet season here. But currently, snowpacks are around 70 to 80% of normal, bodes for continued drought and dry conditions. We all hope for a wetter February, March, April before those forecasts emerge. As part of our Building Back Stronger agenda, we are seeking funds around wildlife mitigation, additional resources to combat wildfires early on, better prepare communities with defense perimeters. And so that's all a part of what we look forward to working with the legislature on as well. Did you have a follow-up, Vinny?
No, not today, sir. Thank you. Have a good weekend.
You too. Thank you.
Governor Charles Ashby from the Grand Junction Daily Sentinel. Thanks for addressing the legislature coming back in, because that was going to be my question. So I do want to ask you a little more targeted one. When you proposed your stimulus plan back in November, the 1.2 billion, whatever it was, one thing you didn't know about at that time was that there was going to be another COVID package out of Congress that probably would have money directly to states and local governments. How do you think, I don't know how much you know about what's in that package, but how would Colorado be different from what the federal government would do, and why would you need to go with a state plan? And is there something different that the federal government just couldn't address?
Yeah, so first of all, we know never to count our chickens with regard to federal legislation before they're hatched. And so, right, are we hopeful, and is there likely to be another package? Perhaps, but there's a lot that needs to happen between then and now. Secondly, what we can do at the state level can give Colorado a competitive advantage over other states that only rely on the federal package, because we can invest in different areas. For instance, roads, infrastructure, shovel-ready projects. That's a big part of creating jobs in Colorado today and building a lasting legacy of reducing traffic, increasing access to our mountain areas going forward. The federal government has more resources. That's why I'm supportive of their efforts to send people $1,400. That's not something the state can do. That's direct money to consumers, increasing SNAP benefits, funding for healthcare to save people money, all of those great parts of that package. But what we're doing here is Colorado specific. How can we best, utilizing this one-time fund carry forward of over $1 billion, how can we best invest in transformational concepts that can really help prepare Colorado for an even brighter future?
If I could follow up, I'm told that the legislature is also going to look at major transportation funding measure. I'm wondering what you can tell us about that, and how does this play into the whole big picture?
Yeah, so there's a unique one-time transformational opportunity for Main Street revitalization, and Grand Junction benefited from the smaller Main Street revitalization program. They received one of the communities that received grants of I'm going to say 50,000, Charles, but you have to allow me the opportunity to fill that in later. It could be 100 or 150. I think it was 50,000. That was only a several $1 million Main Street revitalization package. 3-4 million. This is a $70 million Main Street revitalization that can really help transform our public boulevards, our downtown areas, encouraging commerce, supporting local businesses, and of course, having a better experience for residents. I digressed, and I'm trying to remember what your question was now, Charles.
Transportation.
Yes. So all of that is one time. We are, of course, continuing the discussion with legislators about a long-term funding solution for transportation, meaning how do we prevent the main funding source from our roads from deteriorating in coming years as we have increased fuel efficiency and more electric vehicles. So that is really the fundamental question. We want to provide relief to consumers as part of that, meaning reducing vehicle registration fees or reducing the gas tax, We're open to different ways to do it. But I think more money in people's pockets and a funding solution for the long term is kind of that sweet spot of what we look forward to working with the legislature on.
Thank you, sir.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Gobernador, desde hoy farmacias como Walmart, Sam's, King Super, entre otras, aplicarán la vacuna del COVID-19. ¿Cuántas dosis serán suministradas a estas farmacias y si el Estado garantizará la disponibilidad?
La Casa Blanca dijo que será un total de 1 millón de dosis de vacuna, de los cuales 16,000 aquí en Colorado. Hay la vacuna en algunos, Walmart, Sam's, King Supers, Kroger's, pero todavía es un poco despacio en los lugares, pero con más tiempo vamos a tener más vacuna en farmacias y supermercados también.
Hello, Governor. Bill Folsom with News 5 down in Colorado Springs. I've got a short-term and long-term COVID vaccine question. With the extreme cold this weekend, do these mass vaccination clinics still need to move forward because of the shelf life? And is there a concern that people may not show up? Longer-term question is, we're 2 months in. We had heard that vaccine numbers, doses delivered would be ramping up in production. I know we're getting the extra 9,000 for 3 weeks, and then Johnson & Johnson will be coming online. But is there any word on production of, getting thousands more doses per week anytime soon?
So the message for this weekend is if you have an appointment, please show up. Please keep your appointment. We are having cold conditions, but most of the larger clinics, you remain in your vehicle, you simply roll down the window, you get the vaccine, you wait 15 minutes and you go. I would be more concerned if there were blizzard-like conditions. That's not what we're facing this weekend. There might be some light precipitation, but by and large, it's cold conditions. So everything continues as normal. Please show up for your assigned time and get vaccinated. It's very important that we don't let Mother Nature slow our progress against the pandemic. And we in Colorado are not afraid of a little bit of cold. So I think we'll get through this just fine. We don't have exact numbers yet on ramp up of vaccine. We are hopeful that Johnson & Johnson will be approved. The FDA is assembling their committee the last week in February. It could be approved as soon as that first week in March. We don't yet have the estimates on quantity, but it will add a powerful third weapon to our arsenal against the virus, particularly valuable because it is a 1-dose vaccination as opposed to a 2-dose vaccination, which allows for greater utilization and doesn't have some of those same storage requirements of especially the Pfizer vaccine, but even the Moderna vaccine. The Johnson & Johnson vaccine requires something closer to normal refrigeration, not even freezing. And while we read in the same articles that you do about the likely increase in doses over March and April, we've heard nothing substantial. The minute we do, we will make that available to you and the people of Colorado as soon as we get any meaningful numbers with regard to the expected future flow of vaccines.
Hello, this is Meg from the Denver Post. As you said, we're now out of this, and it appears that the cases at least have somewhat leveled off. Does that change anything for your decisions on continuing to loosen restrictions?
So again, right now cases have leveled off. We need to continue this trend. It's wonderful to see those hospitalization numbers decrease, and we are not approaching our hospital capacity. And more Coloradans are gaining protection every day. So I think it can be expected that as more and more Coloradans gain protection through vaccination, especially those over 70 and then those over 65, and in March, people with pre-existing conditions. As long as there's not a third wave, because people radically drop wearing masks and start assembling together, then we can expect that those safety protocols will continue to loosen over time as more and more people are protected.
With allowing people to congregate in restaurants and such, for example, does that increase the odds of a third wave?
Well, it's really more a function of what people choose to do. As I've said a number of times, a restaurant itself is a virus neutral location. It's no different than someone's home. It's really what you do there. Are you going out to eat with the people in your family that you live with? That's low risk, low to moderate risk. Or are you meeting 6 people there from 6 different households and engaging in close contact unmasked for a period of time, in which case it's very likely to go from 1 person to 4 or 5. So it's what you do. It's not where you are. And wherever you are, large groups of people from different households without masks, close proximity, that's what the virus loves, and that's what leads to more deaths and hospitalizations.
Thank you.
Hey, Governor, this is Gabrielle Franklin with Fox 31. So we know that this weekend, state-partnered COVID testing sites will be delayed or closed due to the weather. So does the state have a plan to sort of adjust just in case we see like a possible influx of cases after these sites are closed?
Are you talking about the testing you're talking about now?
Yes.
Yeah. So there is great availability of testing in indoor sites for those who are experiencing symptoms. Go to covid19.colorado.gov, click on sites. If you have difficulty accessing testing because of the weather, please assume that you should quarantine yourself and that you might in fact have COVID if you are exhibiting symptoms. There's a very reasonable chance that it might be COVID. So if you're unable to get out because of the extreme cold Saturday or Sunday and need to wait till Monday or Tuesday to get out, go ahead and quarantine yourself until you're able to get tested.
Got it. And I know that you said the state is still looking at the latest allotment of vaccine allocations. But when it comes to getting the state to be a leader in vaccine distribution, what else could we be doing better? And what are you looking at to sort of ramp things up?
Well, look, we use every vaccine we get in Colorado, and we implemented a rule from the very start that if any provider or partner has one for more than 3 days, we will look at reassigning it somewhere that will use it. Reaching geographic equity and balancing to make sure people across our state can access the vaccine. We're stepping up clinics in underserved areas, whether it's at Black churches in Denver or the San Luis Valley, to help serve people that might not be part of or regular customers of our hospital system. I want to compliment our hospitals for really stepping up, UC Health, Centura, Kaiser, many others, and really being able to run vaccination clinics at a large scale. We mostly just need more vaccine. I mean, we showed at Coors Field 10,000, Stock Show 5,000 this weekend in Colorado Springs, UC Memorial, going to have 5,000 in a day. But we can only do that for a day or two a week because there's not enough vaccine. If we had enough vaccine, we could have those large scale clinics running 6 or 7 days a week, and we would be able to administer 400,000 or 500,000 doses of vaccine. But we're currently only receiving about 90 to 100,000 a week.
Hi, Governor. Jason Grenauer here with Denver 7. As we get closer to hitting that 70% of 70 plus vaccinated, that moves some 5-star businesses in yellow counties that much closer to being able to move to blue. How close are some counties to getting to that 70%? And will the state make those percentages within counties public so people can kind of follow along and know when they're getting close?
So I believe and I'd have to check, but I believe that the goal is expressed as a statewide goal rather than a county goal, just simply in recognition of the fact that people are moving all over. And so it's when we as a state reach the 70%, then it triggers that for the entire state. So I'll double check that if you don't mind, but that's my memory of the situation. And we are about a week or two from reaching that away. I would say within about 2 weeks or so, we hope to be able to achieve that, which then enables the 5-star businesses, which when you see a 5-star business in your community, it means you can have confidence as a consumer that they are taking extra precautions around COVID, that they have got the knowledge, the training, the steps that they've taken to reduce the risk. And so you as an individual who has not been vaccinated yet can have more confidence shopping or dining or enjoying their services. Of course, taking the precautions, of course, with mask wearing, you need to take, but they will be implementing that in a better way. And there are already many counties in our state that are orange, and those businesses are functioning in yellow. And there are many that are yellow, which they will be functioning in blue shortly when we've achieved the 70% of the 70 and up, which should be in the next couple of weeks. Go ahead. You have a follow-up to answer your question?
Yes, and as a follow-up, you've said that everyone 70 plus who wants the vaccine will be able to get it by the end of February. That could potentially be more than the 70% state goal. So are there enough vaccines out there that you can guarantee to those 70 plus in our state, if they want it, they'll absolutely be able to get it by the end of this month?
Yeah, if you're 70 and up, you should be able to get the vaccine by the end of the month. I hope that, and I hope that 70% is a floor, not a ceiling, right? We know that from our research and what we know that at least 70% want the vaccine. I really hope that, especially if people 70 and up, it's 80% or 90%. And look, I'm sure you'll find, some 75-year-old somewhere that for whatever reason wasn't able to get it till the first week in March. Maybe they couldn't drive to where they needed it, or they couldn't get an appointment. But yes, generally speaking, if you're 70 and up and you want the vaccine, you'll have the opportunity to get it by the end of February. I'm sure there'll be a few folks 70 and up that continue to get it after that. But some are waiting. They want to see I was at a clinic last week in Denver, a nice older African-American lady, kind of church lady. It was a church-based clinic and, late 70s. She said, I'm the first in my group of girlfriends to get it, and they're seeing how I do. And my 5 friends are going to get it, next week if it's okay. And so, of course, if it's okay, and she's going to bring them in. But there are some, after you get to that 70% who want it, there's going to be some who just want to see more other people get it first. And that's understandable. And I hope that they get it as well. But yes, for all the folks that are over 70, are seeking to get the vaccine, nearly all of them will be able to get that in February. I'm sure there's some that might have logistical difficulties that might mean they can't get it till the first week in March, but they'll largely be able to get it in February.
Hi, Governor. This is Lori Jane Gleehawk from Fox 31, and this is an unemployment question. Last night, Fox 31 reported that the state has already overpaid nearly $93 million in unemployment benefits since the start of the pandemic. So the state's written off more than $61 million and waived about $1 million in fees.
Good afternoon, everyone. It's just about 1 o'clock. I'm Jason.
Complaints from people who've experienced trouble accessing their benefits, and what efforts are being made to prevent more of this?
So we have a very kind of simple lens that I look through these things when they're raised to my level. If it is our fault, meaning that it's the state's fault, and somebody gets an additional payment, they obviously spend the money, they get an additional $300-400. It's not their fault, it's our fault. It would be very cold-hearted and cruel to try to go after them for money they don't have, and also unproductive because they don't have the money. So we write that off, and when it is their fault, meaning when someone misfiled, either deliberately or inadvertently, maybe they put the wrong number in a form, and they get more payment for that reason, we then seek to have them pay back the state to make us whole, because that is their fault. In some cases, it might be deliberate fraud. In other cases, it might be unconscious fraud. In other cases, it could be an honest error. But regardless, if there's an overpayment based on what somebody has represented to us that is false, we will aggressively pursue the recovery of that money.
Oh, we didn't have a cam.
Does the $93 million seem disturbing to you at all, given budget constraints that we have in our state, or what do you make of that number?
Well, that's not the number that's been presented to me, so you'll have to let me do a written response on that, because I think it's more technical than that. It's not like there's 93 million that has been defrauded from the state. That's not the case. I know this is a detailed piece here, so if I can get back to you with the numbers on that, but that's not the it is a number, but it's not the number that has fraudulently been paid out.
Hi, Governor Polis, Claire Cleveland, CPR News. So the CDC just put out guidance that schools K through 12 should feel safe in reopening, even if not all the teachers have been vaccinated. That's something you've been advocating for some time now. What would you say to districts that are holding off on getting some of those older kids back to the classroom?
I think the benefits of having kids in the classroom far, far, far outweigh the risks. It is so important educationally, socially, psychologically, for kids to be able to be in school. We've demonstrated that it's safe with the layered protections that Colorado schools have successfully implemented. I'm glad to have the CDC verify that information. Even there are some high schools that are 2 days a week, and again, that's a lot better than nothing. I hope they return to full instruction shortly, but even 2 days a week is helpful in terms of making sure that we're really engaging students, especially those who are most at risk. So I was glad to welcome this additional support from the CDC about the importance and safety of getting kids back to school in an environment where we can keep educators and children safe.
Great. I have one more question. So earlier you said, that you don't count your chickens before they're hatched in terms of the federal government. And yet earlier this week, I believe you had talked about not prioritizing unhoused folks in Denver and that the Johnson & Johnson vaccine may be better for them. Let's say in some realm that vaccine does not get approved, will you reconsider kind of changing the plans around those folks?
Of course, we would re-examine that, and that is not a federal political process. To be clear, it's a scientific process at the FDA that is removed from politics, where they're reviewing the data. I'm confident that the Johnson & Johnson vaccine will be approved. It will be a very useful vaccine for folks that might be migrant workers or be unhoused, who might not be in the same place or able to be found to provide a second dose of one of the two-dose vaccines. So it's a very powerful tool. It'll be very helpful to be able to serve our more mobile population, whether they're unhoused or housed, with the Johnson & Johnson vaccine. I'm optimistic based on the scientific data that it likely will receive approval. If it's not, we would have to re-examine how the existing two-dose vaccines can be used for more mobile populations effectively. Thank you all so much for joining us. Have a wonderful, safe weekend. God bless America.